Welcome to the pre-registration AHP Student Practice Learning Programme webinar. Really lovely to start off the day. We've got 2 fantastic hours lined up with some amazing presentations. So my name's Samantha Nolan and I'm the Programme Manager. So today's plan, I've got a few slides around housekeeping. We've got some absolutely fantastic presentations, and starting off with an introduction from our Programme Director, David Marsden. We've got presentations around leadership, professional body and public health practice learning. We've got a 5-minute break, just a little comfort break, and then we will move on to research practice learning, teacher practice learning, and then a 20-minute session for questions and answers. So if you do want to put anything in the chat box, any questions, Ruth Allison will be leading and chairing that section, and some of our presenters will be able to answer some of your questions. There might be a lot, so there could be themes for that. So I'll just move on quickly. So if you could all please mute your microphones. I've put a slide square in the middle, shows you how to do that, the red box there to press mute. There could be a slight lag because the world of Microsoft Teams is sometimes we will be talking and the presentation slide might move slightly later, so don't worry about that, that's normal. Can I please ask you all to turn your cameras off? And just to let you know that the webinar will be recorded, and I'll be sharing a link later of where you can access that once that recording's downloaded. So the purpose of the webinar then, the NHS long-term plan highlights that our health and social care system struggling to cope to meet the demands of our community, our families, and COVID-19 pandemic has compounded that issue. So this webinar is to share some amazing AHP innovation and creative developments and share that with you today. So we're going to look at addressing placement capacity and driving expansion through sharing some of the amazing work that's going across the system. So this is the link for where you'll access the recording of the webinar later, but it's also for you to note that it's a place to also look for any up-to-date national policy and guidelines from our arm's length bodies, a place for sharing best practice and innovation around placement capacity, and just if you need any support or any resources, I would really recommend that you click on to our Health Education England website. So without no further ado, I would like to move on to introduce you to our Programme Director, David Marsden, to introduce the programme for you.
Thank you, Samantha, and good afternoon, everyone. I'm delighted to be with you today to talk about the programme, but also to tell you why this today is really important and to supposed to spell it out to everyone. Next slide, please, Samantha. Next slide.
Right.
Thank you. So with the programme, what are we trying to achieve? The programme is fairly early in its stages of development. We've only been working on it for 4 weeks, but we're very clear that we need to ensure that there's an adequate capacity for practice learning for AHPs across the country to make sure we meet the recovery and growth needs. So the clear objectives, the calculation from the long-term plan is that we need 1,500 extra placements. We need to evaluate the use of clinical placement expansion funding, which is the investment that's gone into systems for innovative and new ways of expanding practice learning. What we're going to try and do is provide a suite of resources to support that expansion and innovation and target where some of the barriers are in terms of expansion. And then we're going to look at providing a sustainable approach to sharing best practice and innovation. And our practice learning exchange, which Samantha shared at the beginning, is the first part of that. So how you can all come together and share practice long term. And also to clarify, communicate and support changes to, if required, regulatory body, professional body and policy to support expansion. That is things like supporting and advising on changes to tariff. For example, so HCIs can be paid for simulation, which we know has been an issue in the recent months. Next slide, Samantha, please. So we're doing this with a bit of an evidence base. So before the program started, you may be aware of the crowdsourcing piece of work that happened to pick up the major themes around placements, the learning points, the solutions and the barriers. So we picked up 6 themes from that, which were diversity coordination, placements needed to be a joined up approach, overall redesign, educator capacity was an issue, and culture and attitude was an issue. So the program is based on this evidence, and the aims that you've just seen are all aligned to what information you all supplied nationally. Next slide, please. Thank you. So these are the key, very high level areas that we're focusing on. So you'll see in there there's three strands of evaluation, which is focused around clinical placement expansion bids. So we're looking at the overall outcomes and the learning we can get from them. We're also looking in depth about the student and the educator experience around digital placements. We're also looking at the enabling pieces that I talked about in terms of producing quick guides where there are barriers. So, for example, information governance with telehealth and telecare placements. That's something you've told us is an issue, so we're producing quick guides around that. The webinar today is one of these series of enablers. We're also doing a thematic analysis of the AHP clinical placement expansion bids to work out which professions, what the themes are in terms of what type of bids there are, so we can carry on the learning throughout everything we do. Next slide, please, Samantha. So why non-clinical practice learning and why now? So I'm guessing a lot of you can answer this question, but the first thing I would say is you all know that we need to meet the challenge at the moment in terms of the reduction in placement capacity due to COVID-19, but also because we've had growth in student numbers. So non-clinical placements can contribute to this in lots of different ways, which you'll hear today. But that's not the only reason we're doing it. We need to answer the question, what do we need from our graduates in the future? What do we want them to look like? And I think lots of the debates that have been kind of going around, which I've been party to, are all around the 4 pillars of advanced practice. And how can we start students thinking and developing not just theoretical skills, but practice skills, so they can start to develop portfolio placements and portfolio careers to achieve that standard of practice. So what I would say is for this, they'll not only need the academic content, but practice learning, which will be showcased today. Thank you.
Thank you very much, David, for that introduction. So I would like to now introduce you to Sandra and Gareth, who are going to discuss leadership placements.
Hi everyone, welcome to our quick whiz through 2 different styles of leadership placements. I'm Sandra Speller, I'm AHP lead and professional head of therapies at Sussex Community Trust.
Hi there everyone, my name is Gareth Cornell. I'm a physio by background. I used to work in Sheffield teaching hospitals and I'm currently working across the integrated care system as the AHP faculty lead for South Yorkshire and Bassetlaw. Next slide please, Sam.
So we started talking about why we jumped at the opportunity to do this, and for me there were 3 main reasons. One is I'm a great believer in the adage, don't talk the talk if you can't walk the walk. And so how can I as AHP lead expect my 840 AHPs to actually offer more and or more diverse placements without leading from the front? I think I've always been very passionate about developing leadership skills at every stage of the career. And thirdly, I actually have always loved having students, so I jumped at this opportunity.
And that was a similar story for me when Sandra and I were chatting and bringing this presentation together. So there was a genuine curiosity. So from delivering placements within clinical practice, which started to include leadership and QI training for learners on placements. But I was really curious about what's the added value here. Are we just compensating for a lack of placements at the minute, or do they really add value and are the right thing to do? So I was very open-minded about that. And very much this needed to be a case of leading by example. So work we're doing within our ICS is focused upon placement expansion across all our organisations. So I needed to put my money where my mouth was. Next slide, please, Sam.
So for me, I had 2 third-year physio students. I'm a physio by background, I forgot to add that in. And they had a combined placement with me, so they worked 2 days clinically and 3 days remotely working on leadership projects. The aim was really to grow an understanding of the importance of leadership skills to healthcare, I think. To healthcare, and to explore this through their own leadership style by working remotely on projects and actually then experiencing it in the clinical workplace as well.
Fab. My story. So we decided to do something at quite short notice. So we had about a week or two to prepare and just respond to there was a bit of a shortage in some placement provision. And so I worked with the university, and there was a fantastic candidate who needed to do a catch-up placement for 5 weeks before then going on to do their elective. So Katie was approaching the end of her pre-reg MSc physio degree. So it was very much just me and Katie, and it was fully non-patient facing across a 5-day week and wholly virtual and online interaction. But we focused a lot around systems thinking, network building, some of the workforce priorities that we're addressing within our AHP faculty around placements, apprenticeships, and building networks around research and leadership development. And we explored some things around how healthcare works, how it's funded, how it's structured, how healthcare education works and is funded and structured as part of our leadership focus, which was really positive. Thanks, Sam. Next one.
Okay, so preparation for the placement. I think one of the key things was making sure you had IT sorted out for remote working, because that's always a bit of an issue. Next, it was very important that I set clear learning objectives, which I did in conjunction with the University of Brighton, who are our local HEI. Essentially, I wanted students to gain a breadth of understanding of actually the leadership opportunities that would be available to them in the future, to help them understand the impact of leadership and leadership styles on patient care and on staff, and really to start exploring themselves as leaders with projects. And those projects we aligned to some of our trust work plans and our AHP workforce strategy, and that was all backed up with a vast range of reading and resources to support their learning. One key thing I think is it was very important to work with the HEI on student selection, because I recognise this sort of placement probably wouldn't be right for everybody. As with all placements, it's really about making sure we're confidence building and not confidence reducing. So that was important. And working along those themes, I think one of the key things that really was important was having an informal chat with the students beforehand, partly to help them see that I actually wasn't a big scary ogre, and that actually it was a real opportunity to answer their questions and queries and worries, really.
Fab. So there were some similarities there from my perspective too. So we needed to work quite quickly with the university, so with Sheffield Hallam University and their placement lead and the learner's academic advisor, just to quickly design things and pull things together. So that identification of the right learner was quite crucial for this opportunity. But there's the information on the slide, there's a mix here of what I did versus what I do next. So actually what I did was we embraced some chaos. We didn't over plan too much just because the time frame was short, and we took advantage of some other opportunities. So there were some QI modules, the improvement fundamentals modules, some of you might have heard of on the NHS QI learning platform. They were just starting at the point that the placement was going to be occurring, so we could access those that were free to be able to access for 4 modules. And then we also were able to access the Edward Jenner programme. as a free-to-access leadership development programme. So that gave me about half of my kind of placement content for independent learning that would have been quite helpful for the learner. But what I'd suggest for next time would be making sure there's time to plan. It was very crucial that we developed a shared workspace and got IT access straight away, so that's quite crucial because it meant Katie could be fully participative. And some of the things that we've then done throughout the placement, we've helped to create for the next placement. So designing an introduction pack, designing an evaluation type exercise to do before and after the placement, and also to identify some learning needs. And I'll go on to some of the other things that we've generated throughout the placement. Thank you, Sam. Next slide.
Okay, so as I said, I had 2 students who were working with me 3 days a week on leadership projects, but they also were working 2 days clinically. So whilst I was their lead supervisor, they also had an additional clinical supervisor, and I liaised and linked in with those supervisors on a weekly basis. I built in weekly project review sessions for their individual and joint projects. And that was really a forum to discuss ideas, monitor the progress, give feedback on their plans and their work to date, which were all really productive. I think one of the key things I would say is the exploration of leadership, I think, was very much student-led, and so I provided lots of resources, and it really encouraged them to follow their interests. So, for example, one of the students read the Francis report and found that quite challenging. So I linked her up with our FTSE guardian so that she could explore that a bit further and understand that. So it was very much led by what was interesting them. Exploring themselves, I think, as people and as understanding their strengths, their values and the way they like to work was a really, really key bit of their learning. But I think that did need a supportive coaching sort of style session, which we built in each week. And I think that was important to enable them to explore themselves safely. And lastly, I was available quite regularly and just for little catch-ups, which when they were working remotely was quite important as well.
So as it was just Katie and I and working remotely with each other, Katie had a lot of autonomy over what she was going to tackle within her week, and we started to navigate actually how to swim through that organisation and knowing that things need to be really flexible, and the structured learning programs like the Edward Jenner and the QI modules were quite helpful because it had a bank of things that Katie could go do when she wanted to get her head stuck into something, and then we had other things planned around one-to-ones and meetings and tasks. There was a philosophy that ran throughout this placement of inquiry-based learning and a flexibility between open IQL and fairly structured IQL. So we designed some learning paths and we built these as a co-design throughout the placement. We acknowledged quite early on, this is very new, so let's design for the future, let's design for the next and the next and the next. So we co-designed all the way through the placement about actually what is it that's needed to be able to run this again? What is it? What's the potential? What could we try differently? So it's a very adaptive space. But we had structured coaching conversations around the talk content from the Edward Jenner in and around meetings or after workshop events to guide some learning. And we did some one-to-one coaching conversations, particularly around development of awareness of self and leadership behaviours. And then we arranged some one-to-one interviews with other people, other key leaders within the ICS that we were grateful for. Fab, thanks. Next slide.
Okay, so this is just really, I'm just going to feedback a little bit and give a bit more detail about the sort of projects that they were working on to give a few ideas. So one of them was working clinically with our full service. So her project was around refining and redesigning some of our resources for staff and for patients, and then gathering feedback from patients and their families on those resources. And then she was asked to present those findings at our trust-wide senior steering group, which she did an absolutely amazing job at. The next one along, they worked together on developing with our professional leads and the University of Brighton, and then they ran completely alone a clinical educator training, interactive training session for our unregistered staff to help to support them in becoming, or becoming part of the clinical educator workforce within our trust. And again, got absolutely amazing feedback from that. One of them was tasked with developing a video and poster resources, especially for students, really, to help them really understand the NHS long-term plan and ICS structures, and engage them in sort of understanding why it was important for them to know about those things. That's because that's where they were going to be working in the not too distant future. And then last but not least, they had a joint project where they were tasked with interviewing senior leaders. I wanted them to then pull together an article about what they learnt about the journeys of leaders, the leadership styles, and any hints and tips that they pulled out from those leaders. So I'd primed a few local leaders for them to interview, but no, they went straight to the top. So they actually were interviewing Karen Middleton, Bev Harden, ICS leaders from across the country. And they produce an absolutely amazing piece of work, which has produced some really helpful insights and learning for others that we've had really good feedback on that as well. So a vast range of projects that they were involved in.
Fab. So what we built on through the placement, we very much created together. So we took some rough and ready learning paths that I'd laid out in preparation of the placement and really built a curricula around those. And that's one of our end products from the placement, is that we have a placement curricula with lots of learning paths around leadership, QI, building digital capability, equality, diversity and inclusion, systems thinking, how healthcare works, and so on and so on and so on. There was plenty also that we designed that we then didn't cover, so preparation for employment, career pathways. So we've designed for the future, and it gives a lot of flexibility for maybe the next time as well. We created a range of IQL activities, so I'd created a few off-the-shelf structured IQL activities. We really built on those together and created a range so that actually in the new year that's ready to go for the next learners that we host. There was a bit of translating of the assessment frameworks from the university that didn't really quite fit compatibly with this type of placement. So we've made some recommendations, and we pulled that together into a report back to the university that we'll go back to them and discuss with, as well as some of the leaders within our ICS. What was fantastic was, rather than take some of the ideas I suggested around quality improvement, Katie decided to design from scratch, which was fab. So we did a lot of work around developing a design brief. And so what Katie designed and delivered was a leadership survey to junior physiotherapists across the ICS, looking at their access to leadership development opportunities, which was a really fab survey, got a good response, and we generated a report that we could present back and look at some action for change. And that's going to feed into some faculty work that we'll be doing around leadership development as well. And then also, as we worked our way through the Edward Jenner programme, as a fab opportunity, we produced a review report just around how, maybe some suggestions how to make it relevant for student learners. It's an even better opportunity. Back to you, Sandra.
So just some sort of thoughts about the placement for me. Definitely expect the unexpected, but be prepared to go with the flow would be what I would say. As I've already explored, don't really set limits or boundaries, because the students will surpass them, and their ideas and plans will be so much better than yours. I learned so much from them myself, such as not setting the bar too low, definitely. I've already talked about the coaching style, but I think that was absolutely important in helping them to explore themselves as leaders, and I had underestimated the impact on them of doing that. And finally, I think working together on projects was really important, because they were so very different. It actually really helped them explore a diversity of teamwork and how you have to work together, understand each other's strengths to pull together some fantastic pieces of work, which they did. And finally, I would say, take any opportunity, if you do a placement like this, take any opportunities like this to share your experience and inspire others. I've already got 6 other leaders within my organisation that have stepped up to the plate and are going to offer leadership style placements. So yeah.
And just because of time, I'll be quite quick on this slide. So for me, I'm still very optimistic, but cautiously. So I appreciate, actually, I have had a fantastic experience with Katie, but it's being mindful of actually that could really much vary. So we do need to kind of test this proof of concept with different kind of levels of learners in terms of their capability, and really see how adaptive this model needs to be. I'd advise people just to think about new ways of doing new things, not just using old ways of doing new things, because this is new territory for us to explore. And we actually probably need to explore the delayed impact of this learning. So Katie was going straight on to do an elective placement straight after this that was fully clinical. So we've arranged some coaching and catch-ups over the next 6 to 8 weeks, so that we can actually see what some of the delayed impact of this type of placement and how to translate that back into clinical practice. And then also as she enters into employment in the new year. We identified the fact that there's some collateral change needed just between the university and placement providers, I think, really to kind of shore up these placements, but just because of time we won't go into that in any depth. But it's good to feel uncomfortable, because actually this is our growth zone, and we tackled that together. And this was a good learning opportunity for me as well. So recognise your own learning that you can gain from this. Thanks, Sam. Next one.
So just very quickly, talking about blending leadership with clinical practice, I did this on purpose because I knew that students would have concerns and worries, particularly as their last placements have been cut short because of that little thing called COVID. But I do think it did help cement their learning and allow them to observe leadership skills in action whilst working clinically, and to try their leadership skills out themselves, working with patients, for example. And both said they actually found the combination really helpful. That's all I'll say, Gareth, because quick we'll rattle on.
And I'm very open-minded, so I'll be fully supportive of it. And I think there's great opportunities here for things at scale. So some ideas I'd like to explore next, we'll be doing this as a group model, so with 6 or 8 other leaders, and being able to identify some core learning stems and being able to circulate learners around us and maximise the learning. And also looking at how could you design something that's really big across an integrated care system or an organisation. So for all of those learners on clinical placements, maybe a day of their week they can take out, and we can deliver some learning at scale around leadership and transformation. So there's lots of opportunities there to blend with clinical practice. Next one, Sam.
So just quickly, just to finish off with, first and foremost, I would say take the plunge. It's certainly been an inspirational experience for me, and one of the highlights of my year, I would say. I do think student choice is key, because I think with the right student choice, it can absolutely boost their confidence and help them fly. I would say, definitely say, be flexible and adaptable and go with the flow to enable the students to explore what has sparked their own interests. And the 2-to-1 model did work well, both because it gave them peer support, but it also enabled them to explore their leadership skills with each other as they working together on project work, which was a huge learning piece for them, definitely.
I think what's written up on in the blue box kind of says it all from me. So be adaptable, and I definitely am very curious about hosting multiple learners, because I think there's lots of advantages to social learning. So I'd definitely like to try that myself next. Next one, Sam.
And just quickly as a summary, my students couldn't be here today, but I just thought I would put up a couple of their comments back. I have caught up with them since, as Gareth said, and actually they have found that this placement has impacted on their follow-on placement significantly, and it was really interesting to learn about this. But that's just one comment, and then Sam, move on to the next slide. And there's another one from them, but they ended both by saying it was the best placement ever. So on that note, I'm going to finish my bit.
Fab. Next slide, Sam. And just my summary again, Katie had a great time. She was very positive and really engaged and staying involved in some work. So we're coming back to do some follow-up work together. That's fab. And she'll be presenting at some meetings in the new year, which is brilliant. So yeah, really good experience, that advice. Thank you, Sam.
Thank you very much, Gareth and Sandra. That was absolutely fantastic. Lots of innovation, co-production really stood out for me as well, and coaching and just learning and growth for all. So thank you very much. Because we're short with time, I'm going to move on to Tamsin and project-based placement experiences at the CSP. So welcome, Tamsin.
Thanks, Samantha. If you could put the next slide on, please. Okay, so good afternoon, everyone. My name's Tamsin Baird, and I'm a professional advisor at the Chartered Society of Physiotherapy. And I'm really pleased to be here today to talk to you about our experience of setting up project-based placements. So in September, we had the pleasure of welcoming 4 students onto a 4-week placement with us. And although we'd previously hosted placements, we'd never before taken 4 at a time or delivered placements remotely, integrated peer learning and remote supervision into their design. And similar to what the others have just said, is as we at the CSP are urging our members to think differently about student placement, it seemed only right that we challenge ourselves to do the same. So first up, we considered what learning opportunities there could be for students within our team. And in doing this, we allowed ourselves to question what a good placement would look like with us. And the shift to remote working also meant that there was more opportunity for different staff to be involved with the placement. And students from universities based outside of our head office locations could get involved too, with geography and space no longer being an issue. At the CSP, we've got a great workforce that's made up of a combination of some staff who are physios and obviously some who are not. And we were really aware that there was a fantastic opportunity for wider learning for the students if they were to spend some time with different members of the team. So we thought about learning from a few different angles. Absolutely, from the student point of view, what could they be involved in? What would be interesting for them to be involved in, and what would they gain some really valuable learning from? We also looked at the opportunity from an organisational point of view, and what would be brilliant to have a student voice contributing to that we were already working on. So we've got approximately 6,000 student members, and therefore loads of the projects are of interest to the students. And working alongside each other and learning from each other was mutually beneficial to the work. So we considered the projects that we were currently working on, and a few of them are on the screen here in front of you. And in doing this, it turned out that we had loads of learning opportunities for students, and we had to narrow these down to what we were going to offer in the placement. We also considered shadowing opportunities, so for the students to gain an increased understanding of the CSP and what goes on behind the scenes, and an opportunity to develop some important skills in practice, such as influencing and communication strategies, for example. We also considered the learning opportunities with the development of leadership skills, as well as the opportunities to learn from each other. So both between the CSP as an organisation and the students, but importantly between the students themselves, as this was a real driver for us taking on 4 students at one time. Next slide, please. Thank you. So when designing a non-patient facing placement, there can be some concerns from students and educators about how learning objectives may be met in this setting. What you can see on the screen in front of you here are the learning outcomes for the new Common Placement Assessment Form for Physiotherapy that's currently out in its pilot phase now. So the learning outcomes here are based on the HCPC Standards of Proficiency and the CSP's Guidance and Code on Professional Values. And so it was a really important exercise to have a look at this and map the placement against the learning outcomes. So under personal development, we've got independent learning and the student taking ownership of their learning, application of learning from university into the practice setting, seeking, reflecting on and responding to feedback, and organisation and prioritisation of what would be a caseload in a clinical placement, but more the workload in a project-based placement. We've then got the communication and interpersonal skills, and communication, similarly to your communication with a patient, The students would be verbally communicating with each others and different members of the team, but also they were producing resources and a non-verbal communication where they had to look at the needs of the audience, very much developed communication skills. Recording of information, working with others and respecting the individuals, the communities and the populations as well. Then on to decision making and implementation, and this incorporates the evidence-based practice, gathering and analysing information. So in a clinical placement, this may be your subjective and objective assessment, but in a non-patient facing placement, this may be a literature review, it may be a Twitter poll to gather information and then the so what factor about what they're going to do with the analysing of it. Problem solving, prioritising and planning, and then the doing, the putting the plans into practice. So in the question, can non-patient facing placements meet learning objectives? Absolutely yes. Next slide, thank you. So this is an overview of our placement. We had 4 students from 4 different universities from 3 different countries, just to make it interesting. We had a 4-to-1 supervision model for the shadowing, the induction and the group sessions. And we had a 2-to-1 supervision model for the projects, where the students worked in pairs. So the whole team was involved, and within their week we also integrated sessions for peer learning. So each student worked on 2 projects and had shadowing opportunities. Next slide. These are examples of 2 of the student projects. So we had a project title and a more detailed project objective beneath it. Now this detailed the specifics of what the project entailed, what we wanted them to achieve, by when, and what resources they may need, so we could be clear from the outset about what the project was all about. Next slide. Thank you. So this is an example of a weekly timetable, with the image on the left being the morning and the image on the right being the afternoon. The dark purple colour was the time that was allocated to one project, and the blue was the time that was allocated to another project. So we had 3 half-day sessions for each project per week. Out of those 3 sessions, one of those was with the practice educator, to be able to use that for knowledge acquisition and to be able to plan the independent and the peer learning time that was coming up for that project for the remainder of the week. The peachy colour is when the students came together on a 4-to-1 model, so that was the shadowing, and every Tuesday afternoon they spent time with our communications team. And on a Friday afternoon, we spent time as a regular feature for a weekly debrief, where the students had reflected, and as a group, if they were willing to be able to discuss that reflection as a debrief. And then during the last week of the placement, the students presented back to the CSP, and we invited everybody along to that to show them what they'd be working on. And what they did was absolutely amazing and completely blew us away. The orange on this slide shows the supervision time. So it involved regular touch-in times with the students, where we were able to sit down over half an hour to discuss what they were doing for that day, and then 1-to-1 sessions on the Friday as well. Next slide. Okay, so these are our lovely students. We've got Sam, Annie, Chloe and Abdul. Next slide, please, Sam. Okay, so now that the placement is finished, it's a really good time to sit back and reflect, and it's important to phrase this in the ways to what the students taught us, because it was massive, the amount that we learned. Next slide, please. Okay, so first up, it taught us to allow ourselves to learn and to make mistakes as you go. And this lovely quote from the educationalist John Dewey is, "If we teach today's students as we taught yesterday's, we rob them of tomorrow." And, you know, the design of this placement was new. It was new to us and it was new to the students, and it was different to what they'd experienced before, both in terms of its delivery and its content. And there's an awareness there that because something is new, it's unlikely to be perfect first time. And my willingness to adapt as we go developed through the placement, and rather than striving for perfection, we quickly learned that it was more productive to co-learn with the students and the universities and to shape the placement as we went. I really think that the students who came on placement with us were really courageous to do so. So they didn't really know what to expect in an unfamiliar area of practice, and their attitude was fantastic throughout. Next slide, please. So secondly, is the importance of creating a sense of belonging within your team. And I think the evidence base here is really well established in that creating a sense of belonging during placements has been found to boost confidence, to boost motivation, and the ability to learn among healthcare students. And on placement, this can include welcoming students into the team, making sure they feel included, supported, challenged, and really importantly, valued. And it also includes being really clear about their role, about the project, and what they're being asked to do. Next slide, please. Okay, so just as we seek to empower patients and communities to take ownership of their health and behaviours, we must also ensure that we empower students to do the same with their learning. So each of our projects was designed to allow freedom for the students to generate and come up with the possible solutions. And their engagement, creativity and learning really blossomed as a result of this. And what they created by the end of the placement totally blew us away. They generated solutions that we could never have thought of, and they took ownership, which resulted in a huge sense of achievement and deeper learning. And on the screen here, we've got examples of what they produced. So the image on the left is the CSP website, and one of the projects was about digital physio and looking at what was available on the website, finding a gap and creating a resource, of which they did the virtual learning on there, which is very apt. Then we've got in the background the CPAF documents there. So as we're developing the Common Placement Assessment form, we tasked the students to come up with a resource aimed at students to explain the form. And again, what they did and the language that they used with it was really engaging and brilliant to see. And at the front there, we've got an image of Chloe, and this is during a video. And they created a video aimed at practice educators to showcase what matters to students on placement. And hopefully that will be released quite soon as a practice educator resource. Next slide, please. Okay, so fourth is to embrace the differences between us all. And our 4 students came from 4 different unis and 3 different countries, as we've said, but also from very different demographical areas. And they brought professional and personal experiences to the group and had different values and motivators and beliefs. And it made me really realise that students on placement are all different. And while some might be confident in group discussions, others are not. Some may find the Zoom calls tiring. Some may have caring responsibilities that they need to work around. And some may struggle with paperwork, for example. And the list of these could go on. But we truly believe that the diversity on this placement helped to shape its success. And it also clearly demonstrates that we cannot presume knowledge or have a one-size-fits-all to practice education. Next slide, please. Thanks. So number 5 is pause for thought. So the importance of reflective practice is well recognised as a key concept to enable us to learn from experiences. And we put time aside for student reflection each week and provided opportunity to discuss learning as a group, should they feel comfortable in doing so. And as a non-patient facing placement, this was considered even more important to really sit back and reflect and discuss the transferable skills that they'd gained and plan how this learning could be applied into other settings, including the clinical settings. Next slide, please. Okay, number 6, evaluate as you go. So the collection and analysis of data to evaluate student placements is obviously necessary to pave the way for improvement. And as well as student feedback, this included feedback from the wider team as well, and how having the students within the team made them feel, and the positive experience this gave to us as an organisation. And it's clear from our evaluation that the students gained a huge amount from our placement, as well as suggesting ways for it to further improve. But it's also really clear what I and others learn from having them have time with us as well. Next slide, please. Okay, this is the last slide from me, and unfortunately I wasn't able to have any of our students with us today, so we've got some comments on the screen here, and one that I want to draw your attention to is maybe the quote at the bottom. So this is from one of our students who went straight onto a clinical placement, and she was able to reflect on the learning from the non-patient facing placement and really start to put the pieces together into what a difference it has made in the clinical environment, which was fantastic to see. Thank you.
Thank you so much. Really, really fantastic. Some amazing learning outcomes achieved there from our non-clinical placement and also non-patient facing placement. So I think the diversity really stood out for me with that, the autonomy that the students had, the self-compassion and the compassionate approach to students, and growth and learning for all. So marvellous. Thank you very much. Moving on swiftly, questions we will address all at the end if you want to add them into the chat box. We'll go to Rachel Mason and potentially Leah, if not Leah's help towards this presentation around public health placements. Thank you.
Thank you very much. Leah has managed to join us, so I'm hoping she manages to get her camera and her mic off okay, and she'll be doing the second part of this. So yeah, next slide please. So we at the University of Lincoln are currently working on a public health expansion project. So looking at creating those placements within what would be classed as a public health arena. So this has been funded by Health Education England, and we're working alongside Public Health England and the Royal Society for Public Health as well. As part of this, there are two streams to the project. So we have two different aims, one which we are heading up and one which the Royal Society for Public Health are heading up. The whole project is being overseen by an advisory group. So we have managed to get together a group of clinicians, people from the universities and students to help guide our outcomes in terms of expanding public health placements. Next slide, please. So the first project is being led by the Royal Society for Public Health, and there are two main parts that they are doing to this. The first one is to explore the barriers that may be present in order to access and provide placements within a public health setting. And to look at those barriers, they have been conducting focus groups. And the focus groups have been across 5 different areas. So we have been speaking to clinicians within the NHS. We have been speaking to universities. We've been speaking to students themselves across the AHP professions. We have been speaking to public health organisations. And we've also been speaking to placement coordinators to try and gain their understanding of what a public health placement actually is. What does that mean? And that actually came up as one of the barriers, saying that we probably need to actually understand this a bit more as well. And some of the things that have already been discussed about whether this is something that is integral to every single placement and public health should be woven into all placements, clinical and non, or whether it's something that could be or should be looked at individually and they should be placements within their own right. Some of the other barriers that have come up are things that I see people posting questions on or that previous colleagues have already discussed. So that idea of students potentially not seeing it as a clinical placement and therefore they're not going to be able to achieve their outcomes. Universities may be being a bit worried about how the students will meet their assessment criteria if they're not patient facing. Questions around supervision and how do we supervise students within these contexts, especially if there are no AHPs of the same type of the student. And then another thing was the assessment documents, which I see the questions coming through as well, talking about the issues there that the assessment documents themselves may create, especially if they are very clinical and patient facing. And the second part of their project is, following this, they're going to look at creating a digital aid. And the idea of this, they talk about it as being a Tinder service for placements. So to try and allow placements that are within that public health setting to match to potential students, to potential projects, and to the HEIs, so that we create a resource that will facilitate this. Next slide, please. So project 2 is the side of this that I'm heading up at the University of Lincoln, and we are aiming to create a national toolkit that will hopefully assist with developing and enhancing those public health placements. There are going to be very different things within this toolkit. The first one that we've been working on is around those learning domains for public health. So how do the 4 sort of core elements of public health, how can they be matched to the standards of proficiency that is expected of all the HCPC AHPs, and then also for other body as well? And so that we're trying to relate public health competency, public health knowledge and skills to those that are expected of them when they register as a professional, to try and overcome some of those barriers of the assessments being heavily focused around what is needed to register as a professional. And we've also been mapping those to the public health skills and knowledge framework to see if we can make sure that we're aligning these. One of the pieces of feedback we got from the advisory group was, if you create an additional set of learning outcomes or an additional set of assessments, it creates another barrier. You're putting something in the way of people being able to access these placements. So for us, we feel it's important to be matching those to the ones that exist and that are needed for registration. Also, as part of this toolkit, we'll be creating case studies. So following those focus groups, the people from those different groups that I spoke about are coming forward to give us examples of how this has worked for them, what they did, how they prepared for it, how they supported the student, all of those details, so that we can hopefully build a resource that includes that to help people understand how they might be able to incorporate this either within their organisation or their university or as a student. Next slide, please. So that is me, and I'm not going to talk any further, because hopefully you'll see the outcomes of our projects as they get published by HEE at some point. It's due to finish at the end of March, so we're hoping to have a launch towards the end of March with all of those things that I've just discussed. But Leah is an occupational therapy student who is with me and is going to talk about her experiences of completing a public health placement.
Hello, I'm Leah. I'm an occupational therapy student, and my placement was with Public Health England. As an occupational therapy student, we have to have what's called a role emerging placement, which is a placement where there is already an occupational therapist in the area that we're going to. The public health placement, it was very much came by assessment. We were both supposed to go to a charity, but due to the constraints of social distancing and COVID, that didn't happen. So then was born this public health placement. It was 6 weeks long, and it kind of tied to our applied health improvement module, which was our module talking about public health and what public health is, the role of AHPs and therapists, not within the service or the area. And we also had an on-site supervisor. This placement for me with Public Health England was entirely virtual. There was Linda Hindle, and we had weekly catch-ups, and with both my long-arm supervisor and with Linda separately to discuss what was going on and what support we needed, if any. And next slide, please. So the three main topics that we had a sustainability project, I was part of the equipment subgroup, and so was Tressa. We started that from day one, and we were tasked with having a look at what the situation was with equipment, key performance indicators, where it goes. It was very much a research project for us, and as master's students we absolutely loved it. We could work with AHPs. Although I was vaguely aware of a podiatrist, for example, I'd never up till this point had a chance to speak with a podiatrist or fully understand the scope of their role. Through this sustainability project, I managed to work with some podiatrists and find more out about their role and their use of equipment. I also got to speak with plenty of occupational therapists, qualified therapists, and got some ideas about what best practice is. So although there was no particular patient and of public health. The second was a paramedic mental health. Me and Tressa had a meeting with several people from the College of Paramedics and staff involved in the running of paramedic healthcare pre-registration courses, and this came about through research about the increased risk of suicide with ambulance staff. We started off just coming to see what was going on, see if we could contribute anything, and through brainstorming together as students, and then through Linda, we came up with the idea of introducing a RAP tool, which is something we'd learned at university. It might not be occupational therapy, pure occupational therapy. It was something that we'd learned, and when we pitched it to them, they absolutely loved it. And we got to research the RAP, critique it, edit it, how we felt might be useful, and draft to the team. And as far as I'm aware, that's now got some funding. We had this week sort of student takeover on the AHP's The PH Twitter page. And Tressa and I, we were given ideas about what we could talk about, but for the most part, it was very much working with other students and thinking what we felt students might benefit from in terms of public health and allied health professionals and how that ties in, and public health within the 4 pillars, which was really good. I'd say throughout all of the projects that we got involved with, I definitely got more confidence, gained more confidence in my leadership skills, and became much more comfortable with the idea of leading from the middle rather than, having to be in charge of everything, and I could delegate tasks a lot more confidently. Also, communication and networking. Throughout the 6-week placement, at no point did I meet up with anybody, and neither did Tressa. Tressa was actually working from Ireland. She'd gone back home. So it was all entirely over Teams, written communication, emails and things like that. So I definitely got an opportunity to network with a lot of people that I wouldn't have had an opportunity to network with otherwise, but then also tailoring that communication style. As I said earlier, I also feel as though I managed to understand the role of AHPs a lot more confidently. going into my, hopefully qualified now. I've not got anything left to do. So my next job in a hospital, I'll have a lot more understanding of what other HPs can do. But then I also feel I understood the role of occupational therapy a lot more completely. That just completely opened my mind to what else I could do. I think before I was very much have to go into a clinical setting, where now I'm much more open to the idea and strategy and areas of practice, pillars of practice. Next slide, please. Into this type of placement, the public health placement, I'd definitely say good supervision was key. I think I was really fortunate that I had Julie and Linda, who were both really helpful, and weekly we could have a half an hour to an hour long meeting. They were constantly responsive to emails if we had any questions or queries, and I feel as though they really gave us confidence to just try. For example, with the RAP plan, we said, you know, I don't know if this will help, but then Linda said, go for it, see what they think, and we did, and they liked it. So I definitely use the supervision that you've got and use those resources. I'd also say have an open mind, because I was quite concerned that how would we ever meet our outcomes. We were not patient facing, but we did, and I think I got a lot from it, and potentially even more than I would from a patient facing role, because I'd done that before. That link there, as part of the public health placement, Tressa and I did a blog detailing in more detail what we'd spoken about and things that we did on the placement. There's a link through that link to Tressa's blog as well, if anybody is interested.
Thank you very much. That was absolutely fantastic. And again, just to see the development through working with different AHPs and that the technology, COVID didn't kind of put the barrier in there to stop that. It's kind of allowed that progression and growth, and it's all skills that are really essential for when you start out there in your initial career. So well done. That was really fantastic. So I will, without further ado, let's take a 5-minute break and then we'll continue. We might have to just slightly cut down the question and answer session just because we're slightly over time, but I'll see you all back here in 5 minutes. So it'll be 1:42. Thank you.
Hello, Sam. Was that an introduction? Sorry, I can't hear you. I'm not sure if you're on mute. Okay, I'll carry on. Hi. First of all, I just want to say thanks very much for inviting Claire and I to speak to you today about research placements for allied health professionals. I'm Marilyn Bradbury. I'm a paediatric physiotherapist in the community and work for Birmingham Community Healthcare NHS Foundation Trust. So my background is looking after children with complex needs and neurological problems. And I've been doing that for many years, and I'm currently an NIHR clinical doctoral research fellow doing a project called the Do More study, and I'm studying at the University of Birmingham. So we talked for a long time in Birmingham about having research students and giving AHP students that experience. And one of my colleagues who I know is listening today, Raman Kaur, actually in 2018 did have some speech and language therapy students working on an outcome measure for people with learning disabilities. But since then, we hadn't done anything further, and I think it was COVID-19 really, and the need to support the clinical supervisors that launched us back into action, and the opportunity came up to do something virtual and research based with the students, and we seized that opportunity. So for me, what I'm talking about today is that first experience of me having students as part of my PhD. And I think what Claire and I really wanted to get across is that research is an adventure, and it's exciting, and there's lots of twists and turns and unknowns, and that's what makes it a great thing to do. So we've got in the centre there the adventure is real happiness, and I think that's true in the case of research. So I had 3 students who we planned would be spending a day a week doing research work virtually as part of the Do More study, and they were helping with our recruitment planning and advertising on social media. And I was put in touch with Claire to do this presentation, and we found a real shared passion for students experiencing what doing research is really like, and beginning right at the beginning to understand research careers and the potential that that's a route for them. So yeah, that's what we wanted to focus on today. Next slide, please. So unfortunately, Claire hasn't been able to join us today because of some technical issues, but I have what she was going to say here. My colleague Claire is a qualified occupational therapist, and for the last 13 years she's been co-director of a research centre, Lab for Living, at Sheffield Hallam University. Next slide, please. So Lab for Living brings together researchers from across the disciplines of design, creative practice and health. Its focus is on research that informs the development of products, services and interventions to promote quality of life across the life course. The research is funded through successful grants, including NIHR, EPSRC, MRC, AHRC, Welcome, the Arts Council, Horizon 2020, Innovate UK, and most recently a £4 million research grant from UKRI under the Expanding Excellence in England call. Their research therefore spans hospitals, care homes, three sectors and industry, and over the last 13 years they've welcomed undergraduate and master's OT students, design students from the UK and abroad, and for undergraduate OT students the placement is part of the emerging role placement offer. Next slide, please. So at any one time, Claire has 5 to 10 live research projects, and students have the opportunity to engage in every aspect of the research process, including co-writing, funding proposals and ethics applications, contributing to literature reviews, interviewing and collecting data, working with end users, disseminating findings, working with multiple sectors, and the students also plan and execute their own personal research project, which usually relates to a facet of their own professional development. Next slide, please. So for me, we were asked to talk about preparation, and I don't think I really knew what I needed to prepare before I'd done it, because it's the first time I'd done it. So it was probably a bit more like the suitcase on the left here and this first experience, rather than one on the right, which we're going to be aiming for. And I think this is a quote from one of the students here, that they thought it was a little bit of a slow start, and they weren't so clear on how to be involved. So I think that was twofold. Partly it was information technology related, and just how we shared documents live whilst maintaining the information governance rules. So it took us a little bit of time to sort that out. And also, once I'd set an initial task as well, it was kind of a week later, because we had that 1 day a week model, that we came back to it, and I think they needed a follow-up a bit sooner than that, just to clarify things and be really clear about what it was I was asking them to do. Next slide, please. So Claire said in relation to preparation, preparation is key, particularly in understanding the experiences and interests of the students in order to offer appropriate learning opportunities. Much time is spent in helping them understand what research looks like in practice, but at the same time, the nature of research is that it requires agility, adaptability and responsiveness. So planning can be challenging, and what she was saying is often it ends up, even though there is a rigorous plan and a package, it ends up looking a little bit more like the drawing here. Next slide, please. So my placement was entirely virtual, and I think there were mixed kind of reactions to that. So these are quotes again from the students. One was really happy with that model and found the weekly meetings via video useful as an update, and another was kind of like, yeah, we would have liked to have some face-to-face. So I think that's something I would plan in from the beginning next time. Unfortunately, this time it was just finding space because of social distancing measures, just being able to book a building where there was capacity we couldn't do. So I think in future, to meet everybody's needs, like one of the other speakers was talking about diversity, and I think we need to make sure that that's included. Or what we did do virtually was one of our public patient involvement meetings. So that was really nice, because the students got to see that us having to be virtual hadn't really been a barrier to that happening. So there were 2 young men with disabilities who've been integral to the project that joined us for that. Okay, next slide, please. Okay, so Claire said in relation to supervision, there was on-site supervision provided by another member of the team, and she was a long arm supervisor. So students were well supported and fully integrated into the team at the Lab for Living and supervised by Claire's colleagues. So Claire acts as a short and long arm supervisor, she says here. Okay, that's wonderful. Thank you. Next slide, please. So yeah, I was quite excited to get some feedback from my first students, because obviously the point is that they learn about the research processes and get an understanding of it, and I wasn't going to know until I got that feedback whether we'd succeeded in that. And I think giving this idea of research being part of all of our job roles and part of the culture of what we do as AHPs, being one of the 4 pillars is really important. So what they said was, if we bring the first quote up. Thanks, Sam. So it gave them insight into how the studies are run in an NHS environment. And it was great to see that the work that they had done had made a positive impact, which was wonderful. Also, they did gather that stuff isn't always straightforward, like that messy line we saw earlier, and some of the processes like ethics and criterias and recruitment strategies can be challenging and complex. And it's fantastic and rewarding, but it has its challenges as well. And finally, the third student said he'd done a Masters by Research already, so that was really interesting. And he was comparing the difference in the NHS and clinical environments. And it was great that he said these characteristics of flexibility, innovation and resilience really came through as being needed. And I think that's true for all research, not just NHS research and clinical research. But it was great that he did mention that perhaps pursuing a PhD one day, which is the golden thread that we're after, really, is inspiring people to want to do that and to see it as achievable. Next slide, please. So this is a quote from one of Claire's students, which I can read out here. So they said they'd absolutely loved the project they'd undertaken with Lab for Living. It provided me with a variety of opportunities, including presenting, working with Alzheimer's Scotland. I've reflected on my abilities, and this placement has provided me with a new way of thinking about making a change and impact. I have the skills to undertake a scope of a service in future, to understand the role of the OT and the value it can bring. And then the supporting person, and virtually was second to none. They gave me the chance to grow and develop, and I cannot thank them enough. And that's a wonderful quote. Again, like we've heard from other speakers, a really positive experience. Next slide, please. So on our placements in Birmingham, as we hadn't done this before, we went for a mixed model. So it was partially clinical and partially research. I feel like we are on a journey, and eventually we would like to be offering full-time placements, but I think we need to build ourselves up to that, really. Next bit of text, please. Thank you. So I think doing it this way, it gave students and the educators confidence that at the beginning we're definitely going to meet their needs clinically, which was really good. Thanks, Sam. It helps with capacity as well, and that kind of sharing for the clinical educators and ourselves as academics, and sharing that responsibility. Lovely. Next, please. Yeah, so in relation to objectives and feedback, that was done by email. So I emailed objectives to the lead clinical supervisor, and then for the feedback meetings halfway and at the end of their placements, I sent feedback about individual students too. Next, please. And again, thanks. Okay, so obviously these were physio students and I'm a physio. The next step is to broaden to different professions. So potentially we are supervising across the board of AHP professions and not necessarily the same group. Lovely, next, thanks, Sam. And like many academics experience, there was a balance of time to be had between the clinical time and the research time, because we did it as a mixed thing, and I think that was challenging. And my last point here on the academic experience was the students were struggling to find enough time, because we'd done it flexibly, that they just completed tasks as we were going along, and when they had time to do that. And actually it would have been better to have a day specified and protected, because they were struggling to always find time to do that, and perhaps I could have communicated a little bit earlier to free some more time up for them. Okay, next please. Oh, and I didn't say as well, yeah, I was really enthusiastic about the opportunity. I'm very passionate about research, as you can probably tell, and I like to teach, and the students helped. The work they did really progressed the project in the way it needed to go. The practice educators were really positive and supportive about the placement, and on the whole, the virtual communication worked really well. Lovely, next. And the students were excited, which is what we were after. And they felt that the project was positive and had the potential to help people in the future, and they wish they could stay around for longer and keep helping, because it was really picking up pace for us to open our recruitment. So that's great to hear, and that it was eye-opening, which is what we wanted. Lovely, next please. So these are Claire's reflections over 13 years, so she's an expert at doing this, and like me as a beginner. So she said it acts as a first step or a springboard for students on a research career trajectory, and the students have gone on to undertake PhDs, NIHR fellowships and returned as volunteers. They've got 2 students who are now staff working with them as early career researchers. It's transformed understanding of research and intersectional working, and past students have maintained links for mutually beneficial relationships and integration of research into practice, and it's really benefited their research team as well, because the students ask critical questions and make them better researchers. Okay, next slide please. So in finishing from me, I think the gold at the end of any journey is what you learn from it to take forward. So definitely avoiding that flexible approach and specifying a day at a time, more rapid follow-up after setting initial tasks, keep going with the mixed model for now while we're finding our feet, making sure we put in that face-to-face time. And I think because we're a community trust, our research frequently isn't medically led, so we're used to having AHPs in the team at the forefront of research. And I think that strong presence makes it easier to host the AHP students within the team. Thanks very much again, and that's everything we want to say, and I look forward to any questions that people have got.
That's it. I've taken myself off mute. I think we had a few technical issues following the break, Thank you very much for that. Absolutely fantastic. Just need to get the slides back on screen for you. Just bear with me. And that was absolutely fantastic. So I really can't thank you enough. I don't want to lose time. So can I hand you over to Helen Batty?
You can't see the slides, Sam.
They're on their way, sorry. They're coming. There might be a slight delay, but working on it. Just bear with me. At least you can hear me. I can see them. I just need to share. Can you see?
No, not yet.
Okay. Any better?
No, just your initials.
Okay, we don't want them.
There you go. There you go. Okay, thank you very much, Sam. So my name is Helen Batty. I'm one of the physiotherapy team and also the allied health profession, one of the allied health profession academic delivery managers at Sheffield Hallam University. I should have had our BSc physiotherapy course leader with me, Jerry Scott, and also some students, Wilson, Imogen and Lucy, but unfortunately, due to some technical issues, they haven't been able to join as presenters. So forgive me for them not being here. Next slide, please. So I'm just going to take you through the background to our placement. So we've been doing a academic teaching and learning placement at Sheffield Hallam with some level 6 physiotherapy students. So we're just going to go through looking at how we map the learning outcomes, the format of the placement, the students' perspective, which unfortunately they're not here to present, they were going to be, our perspective as educators, and then our future plans. Next slide, please. So our placement came about in a very short space of time. So we'd been talking about it for a little while after an initial tweet was shared by Ruth Allerton. Coventry University had done a similar sort of thing with some OT students, and I saw this tweet and thought, wow, you know, why have we not done this before? We talked about it with the team, and there were certainly some reservations. Clearly our workload, all HEIs, and everybody else at this time, the workload is huge in terms of everything that we've had to do to change the curriculum, and the team had definitely got some reservations about the sort of added workload and time constraints around this. And then in November we had 7 BSc students and 2 MSc students who we just couldn't place. There was no placements for them at all. So at very short notice we really wanted to make sure that they were still able to qualify in June, July. So it was really all systems go with planning this placement. So we talked to these students. They were clearly, you know, unhappy. They hadn't got a placement, and we offered them this opportunity, which it was, you know, they hadn't really got too much of a choice. They'd got an opportunity of taking this placement or deferring the placement and qualifying at a later date. Next slide, please. So the students all took the option, which was great. So we then had to put the placement together, like I say, in a very, very short space of time. So one of the main things that we had to do was map the learning outcomes. I know Tamsin and some of the others have talked about how we did this. So there were some reservations about around the learning outcomes in terms of they are very clinically based, and we couldn't change the learning outcomes for the module. They are approved in validation, so we were unable to change them. So we had to look at them and think about them differently in terms of this placement, as others have already said. So just to say briefly, in terms of this is one of our learning outcomes. So the treatment and interventions were around teaching and educational interventions. The students still had to assess the situation and environment, but in a different environment. They still had to identify problems and use different strategies to problem solve. They had to reason around what they were doing, but again in terms of teaching and learning, so they had to verbalise their knowledge and show us their reasoning about what they were doing and why they were doing it. So when we looked at these learning outcomes, it was actually fairly easy to map them, even though they are quite obviously clinically based. Next slide, please. So in terms of the placement format, we looked at what modules were running at that particular time. So the students did 2 days a week of teaching and preparation, and there was a mix of online or face-to-face. We'll talk about that in a moment. They all had a project to do, so they had some project work which was around about 2 days a week, and then they had an online learning package for their underpinning knowledge around teaching and learning, which they did asynchronously. So we had some different models. So there was a musculoskeletal clinical module running for level 5. So that was a 5-to-1 model. So 5 students to 1 educator there. The MSc students, pre-reg students, were on a neurology module with a 2-to-1 neurology focus, 2-to-1 module. And then I was an educator for 2 of the students on an interprofessional focus, because again, we had some level 4 interprofessional modules which run across our programme, including social work, nursing and all the allied health professions. So they were able to work with us on those modules. And I also have an interprofessional focus as another part of my job, and the students were able to come along to lots of different areas of that. So they learned in that interprofessional module. I was particularly keen for them to learn about different aspects of allied health professions, really. So they came into various different meetings with me, the department leadership meetings, they came into assessment meetings for the university, student experience meetings, equality, diversity and inclusion meetings, and they also came into a meeting at the Charter Society of Physiotherapy for Education reps. So those students with me had a very rounded sort of placement and really learnt about the wider aspects of education, as well as the wider aspects of healthcare professions, really. Next slide, please. So in terms of the teaching, they had face-to-face teaching. Some of them had face-to-face teaching, those doing the neurology module and the musculoskeletal module. Some of them did some online teaching. My students on the interprofessional were purely online, so I haven't actually seen them face-to-face at all. But it also meant that one of the students was actually in Hong Kong, and because we were unable to get her a placement, she was able to actually stay in Hong Kong and has done the whole placement from there, which has been great for her. They helped with student support. They obviously did some teaching prep. They helped students around different preparation for sessions that they needed to do, and they put lesson plans together. Next slide, please. So they also had a project to do. So the students on an MSK focus had a project around creating some anatomy resources for our level 4 and level 5 students. Our MSc students were putting some resources together around neuroanatomy, and the interprofessional students did some project around, one of them did the value of interprofessional learning, because we really wanted to do this for new students coming into the university, to show them really why they were going to be learning interprofessionally as part of their course. So really to improve that understanding for new students coming in. And then my other student, Lucy, was putting a project together around the marking and moderation process within the university, again to improve overall students' understanding of that process. And hopefully their sort of satisfaction around that process, because there's always lots of dissatisfaction, shall we say, around the marking and moderation within university. Next slide, please. And then alongside that, they had this online learning package, which they did asynchronously to really improve their knowledge and understanding around the underpinning values and knowledge that they would need in order to be a good teacher, a good facilitator. So they looked at facilitation, they looked at the theories behind learning and teaching, different learning styles, assessment, how to put lessons together. They looked at the sort of the research around inclusive practice and also reflection, and all of those things obviously are really key for us as health professionals, not just in teaching and learning. Next slide, please. So as part of that, they did various tasks along the way. So we sort of built them up to taking teaching sessions fully by themselves in this sort of over a period of the few weeks that they were with us. So they had individual tasks to do, they had group tasks to do, they did a micro teach within the first couple of weeks, which was around nothing to do with healthcare. So we learned how to cook. We learned how to do our eye makeup and various other things, which was really entertaining. But again, it gave them a real sort of that underpinning knowledge about how to plan a teaching session themselves and the different things that they could use. They analysed papers, they put mind maps together, and they did all these things together around learning theories. And they built up to planning and delivering a teaching session fully by themselves. And then at the end, it all sort of comes together with a reflective screencast. So they can really reflect on what they've learned over these last few weeks, what went well, what didn't go so well, and show us their reasoning about why they've done what they've done in terms of that knowledge and understanding of the key learning and teaching theories. Next slide, please. So when my colleague Jerry and I, the BSc course leader, when we looked at putting this presentation together and sort of thought about the transferable skills that the students had got, this is just a few of them really that we could have kept on going with the things that we thought that they'd got out of it really. So obviously communication, I mean, they've come on hugely in terms of their communication, and they're now leading sessions by themselves, something that they never in a million years would have thought that they would have been able to do. So, you know, their confidence has improved tenfold. They've had to work by themselves, they've had to organise themselves. The placement's really been full on. They've had a very, very busy time each week with lots of different aspects to the placement, and they've had to organise themselves. So clearly the teaching sessions, we know, were set in stone. They couldn't do anything about that. But the other parts of it were really, they had to fit in the project management work and the online learning work. So they've really had to work well by themselves. They've worked together, they've supported each other. And again, all of these things will really transfer into their future practice. Next slide, please. So unfortunately, the students aren't here to be able to tell you this themselves, but they have put these slides together. And they will all agree that they were really disappointed in the beginning that they didn't have a clinical placement, and they weren't too keen when we put this option to them. They were very nervous, they didn't really know what it entailed, and they felt that it was a bit unfair really, because they wouldn't be getting the clinical skills and gaining the clinical practice that they felt their peers would be. But once we'd sort of talked to them and put the sort of told them what we were planning, they then became, you know, quite excited to start and do something new. Next slide, please. Thank you. So this is what the students think they learned, and clearly they've obviously really done lots of teaching facilitation, and they know that that will improve their ability to teach their patients and work with staff and deliver in-service trainings. They will have hugely, you know, much more confidence in being able to do that in the future. Their communication skills, as I've said, have massively improved. They've been able to adapt to different situations. They've been able to think on their feet. They've been able to answer questions. So again, all things they're going to need to do in clinical practice. And we've talked about the time management and how their skills of doing that again have hugely improved, and their project planning, which again will feed into service improvements when they're in clinical practice. They have gained huge technological skills. They've had to do lots of online learning, use breakout rooms, use different platforms. They're putting their projects together on various different platforms. So again, a huge amount of learning has gone into that. and lots of learning around interprofessional working and team working. Again, all of which will feed into their future practice. Next slide, please. So these are some of their reflections. They have said they're really surprised. They've really enjoyed the placement and found it extremely rewarding. They found it rewarding in terms of the feedback they've had from other students, the feedback they've had from staff, which has been fantastic. They've been really motivated throughout. They feel, like I say, that they have had learnt lots of transferable skills, which are transferable both to their clinical practice and their future learning. They're much more confident about going forwards into their future placements and their careers. And they've got a greater appreciation for us as teachers and lecturers, and the other side of the camera, if you like, that they've never seen before, and the hard work that they recognise that perhaps they don't see. They have said that they would definitely recommend this placement to others, but there is a caveat to that they would really like to have a split placement. They still feel that they have sort of missed out a bit on clinical, and that ideally they would like to have this placement with some clinical element to it. But you know, on the other hand, they've really enjoyed it and they would definitely recommend it to others. Next slide, please. So, oh, can you just go back one, Sam? Sorry. So in terms of what we've learned as educators, we've learned that anything is possible. Obviously, we've had to put this together in a really short space of time. And I know it was mentioned earlier that HEIs need to be role models. We are asking educators to take more students in different settings. And you know, so it's been absolutely great for us to do that and to have, you know, these 5-to-1 model, as my colleague did. It has to be a team effort. We couldn't have done it without, you know, lots of other members of the team who have helped us to supervise students, helped us with the technology side of things, and you know, and in that student support setting as well. Having placed students as the team is really paramount. We've tried to include them. They've been included in lots of team meetings. So, you know, like Tamsin said earlier about having that sense of belonging as being part of the team is really important for any placement. We've learned that students will thrive in any setting, so they really have thrived in this setting. They've really come out of their shells. They've done some amazing work with their projects, and we're really proud of sort of what they've done. And we're going to be able to use the things that they've done, those resources that they've used for other students, and so that's been absolutely fantastic. Changing the culture around these settings and these different types of placement is a challenge and something that that we need to work on, but it's opened our eyes and people within the team to these different types of placements and how transferable they are to clinical practice. And in terms of future plans, we're working on evaluating the project both from a staff and students perspective. We're hoping to evaluate the students' thoughts now at the end of their placement and after their next placement, so we can really see whether they think it has given them some value for their clinical practice. We're expanding the model within the college to different professions, so the OTs are taking some students and using this same model, so we're helping them with that after Christmas. And we also have some lecturers who have split teaching and clinical roles, and so we are hoping to do the split clinical role as the students are wanting, but we're really wanting to take this forward and expand it. So thank you very much. If anybody wants any more information from any other HEIs, then please do get in touch with us. Thank you.
Thank you very, very much, Helen. That's some amazing examples of flexibility and innovation from AHPs, HEIs and people across the system to make sure that we can train, educate and learn, and we're all learning and growing at the same time. So some great chances to kind of improve your confidence and growth for educators and for students. So thank you very much. I'm going to now introduce Ruth Allerton to open up the question and answer session. We have a slightly shorter session, but I'll only need 2 minutes to wrap up, so we can move this session on until to close this at 14:28, if that's okay.
I'll do my best, Samantha. Can I just add my thanks and to our presenters today, because that was really fabulous to hear the work that you're doing to keep our students progressing and to broaden the experience that they're having. We have had some comments from the audience about how they wish they'd had these opportunities, and actually they might be useful as career development opportunities going forward. So our students now are getting something that our clinicians haven't had in the past. And it really makes me proud to be an AHP when I see how creative and innovative and solution focused everybody is in this work. So there were some really positive comments about the AHP, the physiotherapy common assessment form, and questions about whether we should be looking at an AHP common assessment form to streamline things. So watch this space, and questions about whether you could supervise students on these sorts of placements outside your own profession. And I think the answer is yes. We've got that situation anyway, so do go ahead and give it a go if you feel that you've got something to offer. So questions in the leadership section. So for Gareth and Sandra, there was some questions about how the students felt. I think this is particularly for Sandra. How did the students feel about having 2 educators, and did you think there were strengths to that as opposed to just having one educator?
Thanks, Ruth. I think it was very important that they had a supervisor while they were working clinically as well, and we did, although it was clear that I was their lead supervisor, and I did all the halfway sort of meetings and end of placement meetings, and completed all the paperwork with them, but worked very closely with their clinical supervisors to get feedback from them, which I think helped allay the students' fears as well, which has come up a lot, hasn't it? That fear about grading and sort of being able to demonstrate your abilities using the current paperwork. That's come up a lot in some of the conversations I've had, and it did help having the clinical feedback as well. But I would say it was still possible to do it using the current paperwork, just doing leadership. The 2 clinical placements we chose were based at the same site where I am, so we were linking in all the time. So from my perspective, I felt it worked really well.
Thank you, Sandra. So Gareth, the survey that you mentioned, could it be shared for the use of other professionals and ICSs? And there was a further question about the QI learning development platform and the leadership development platform. I don't know if there's any potential to share those resources, or to put people to get in touch with people to see how they could access those resources.
Yes, I think the survey was a really good kind of feasibility test. The plan is, I hope, for us to develop that into a next stage of doing an allied health professions wide survey on accessing leadership development opportunities early in your career stages, and maybe do that on a regional scale. So I think if anybody wants to collaborate or share between ICSs, just get in touch. My email was on the presentation. Same too, there's so many resources that we created during the placement, so we have a open spirit to sharing, so just get in touch and I'll be able to signpost you to things and share some documents with you. The Edward Jenner programme is through the NHS Leadership Academy. I'd highly recommend people to do it. If you're in practice now and you've not undertaken it, do so. It's very good entry-level training programme, and that's open access for students to be able to log on and do. And the QI learning things they're just about to start a new round of them. So again, we can do some follow-up. I'll try and quickly drop it into the chat if I can, whilst other people are answering questions as well. But yeah, just get in touch.
Thank you, Gareth. There was a question about adapting standardised placement marking criteria. I would open that up to generally to anyone, and perhaps people from the HEIs have got a response about that one, how we could help leaders or other people offering these types of placements to adapt the criteria. Is there don't know, Helen, can I give that one to you?
Sorry, can you repeat the question, Ruth?
Well, it was a question about when, I think it relates back to marking and adapting for these placements, but adapting standardised placement marking criteria, which the questioner felt were aimed at the clinical setting, so how we can adapt that to less clinical settings.
Yeah, I think it's about like you said, adapting to those different settings. So looking at those marking criteria and thinking like we did. Our service users were students. So, you know, if it's about service users, then who are the service users at that point in time? It doesn't have to be a patient. So it's about just looking at those learning outcomes in a slightly different way. You can't change the learning outcomes, but you can adapt how you look at them, which is what we did. So we just looked at them and just sort of changed the language slightly for our own benefit, if you like, in terms of that marking criteria. Does that answer the question?
Hopefully. Thanks, Helen. I think potentially the answer is to talk to the HEI that the student is from and get advice on how that can be managed. Question for Rachel. Around the toolkit that you're developing, will that take soundings from AHPs in local authorities and NGOs as well?
Yeah, definitely. We've, as part of the focus groups that the Royal Society for Public Health did, there was representatives from local authority, and there was a group that specifically looked at community voluntary private sector organisations. So we've managed to gather some thoughts from those, and hopefully we'll be able to get at least a few of those to write a case study for us that we can actually publish. But yeah, we're definitely listening, and I saw the comment come up about it, you know, public health being central to a lot of the things in local authority. So yeah, it has been a focus.
There was, thank you, Rachel, sorry, there was also a question, and generally I'd ask anybody who, all of the presenters, and to think about this one, maybe come forward, is that do you think with these types of opportunities for practice learning, that they're more appropriate for students in their final year? Anybody?
I'm quite happy to just say the some of the barriers that we found was this conversation around the perception of who should be doing these placements, what year should they be in, how long should these placements be in. A lot of questions around when we don't put them into clinical areas, who is that most suited for? And there was a varied understanding, and yeah, there was no sort of common agreement. Some people said better for third years, better for the final placement, and some people said actually why not start them off with this, and it's better to start thinking sort of wider right from the start of their courses, so they're not narrowly focused then on clinical placements only. So I think it's an individual thing.
Can I just come in there, Ruth? Because I agree, because our two pre-reg MSc students, this was their first placement. They hadn't had any clinical experience prior to this. They were clearly worried about that, but actually they have absolutely flourished, and they can really see the benefit of what they've done in terms of their future clinical practice. So I would say it doesn't matter what year they're in, that they could do these types of placements at any level.
Yeah, I totally echo those views. And we had, from our 4 students, we had them, they weren't all final year students. So it was really interesting to see the learning that happened at different levels, and widening that access to students coming into these diverse settings at an early opportunity was great. What I would say is maybe with some of the projects, depending on the nature of them, may be more suited to students who have had experience in something. So for example, we had projects on placements, so having the student been on a placement before was a prerequisite to that.
Thank you, Tamsin. I'll just round off now because we're coming to the end, so apologies if you've asked a question and we haven't answered it, but HE are creating resources around supporting students on these sorts of placements, and placements where they're enabled by technology. But I think I just want to say, if we're really serious about our students going on to be advanced clinical practitioners and first contact practitioners, and we're also serious about clinical academic careers, then it's really important that our students are exposed to the 4 pillars of practice right from the start of their education journey. And these placements are clearly offering fantastic opportunities for our students to engage with those pillars. And thank you to everybody who's supporting them and helping them progress. And I'll hand back to you, Samantha.
Amazing. Thank you very much for sharing that, Ruth. And just to say, echo your comments. A big, massive thank you to all our amazing people who've helped with your innovative ideas and shared all your learnings today with us all. It's been a really valuable 2 hours. Thank you all to the students that also contributed with so much co-production throughout. And a massive thank you to people back scenes, Bill and Jasmine. You've been absolutely amazing. Just some next steps. So we've got 2 workshops coming up in teaching and leadership as part of the programme between January to March, so watch this space. And we're also launching some quick guides in leadership, teaching and research. Thank you very much for all your time and attention, and everybody's intervention and participation in today. It's been wonderful, and at that we shall close. Thank you. Goodbye.